Ladies and gentlemen, Excellencies, Indonesia is an archipelago consisting of more than 17,000 islands. However, efforts to protect health insurance for entire population, universal health coverage, have only becoming Indonesian focus through the implementation of the National Health Insurance Program, we call it JKN, which started in the year 2014. As September 15, 2023, number of people who have been achieved and as the member JKN program protection has reached 263 million or 94% of our population. And then, the out-of-pocket from 49.9% in the year 2014 now reduced to be less than 25%. The challenge of how to provide primary health care for all members, primary health care in the JKN program currently consists of promotion, prevention, and curative and collaborative and also rehabilitative, especially for personal care. In order to deliver primary health care until August 2023, more than 23,000 primary health cares and 3,000 hospitals already contracted. And 63% of these health facilities are privately owned health facilities. And in order to provide primary care to remote areas, several floating clinics and hospitals are also contracted by BPJS Kesehatan. And the utilization is increasing so much so that in the year 2022, already more than 500 million utilization, and a day more than 1.4 million services, increasing trust from our members, also increasing the utilization of services, increasing spending by more to billion US dollar. Then the JKN program emphasizes on promotion, prevention, since it is the backbone of the national health system. Therefore, several programs to improve promotion prevention include health screening, disease management program, and teleconsultation to increase the performance of primary healthcare performance. Base capitation and risk-based capitation is being used by BPJS to pay primary healthcare facilities. And also we are now quality transformation to increase the quality of care. Lastly, BPJS Kesehatan also developed information system to create iCare JKN mobile medical history record in the hand of our members in primary care.
I thank you, Head of Indonesia Social Security.